live. My followers are going to come rushing. No one here at the moment. Of course, there are. Jackie's here. Of course, what am I saying? Hi, Jackie. Nice to see you. Here. Bridget's here. Bridget 60. Congrats. So, we've got some questions to be answered. Corinne and JK Vix. So, good evening, all. One and all, welcome. Doors are open. Quick, get in before the rush. Because you and I both know it's going to get pretty busy in here. I think we Facebook's still wide open, but that's okay. Right. So what we got? I'll tell you what we got. We've got some questions, which I will now answer. And if you've got a question, by all means, chip in. Don't be shy. Here we go. This one, 10 stone weight loss is the title. So. Hey up, my duck. Happy Tuesday, right? Happy Tuesday. Is it Tuesday? God, I've lost track. And happy Tuesday to you, my duck. Require skin removal in the stomach area and over the hips. Stomach area over the hips. But also have excess skin at the top of the tummy. However, FDL diagnosis is borderline. Is FDL best done at the same time as the 360 belt lipectomy? Is it possible to get a good result if you have an FDL in a second surgery? Good God. Right. Okay. So, all right. A little bit to unpick here. So, first of all, massive weight loss, 10 stone weight loss, huge. I don't think anyone would argue with the enormity of that weight loss. That is a huge amount of weight to lose. So, massive congrats to you. And I am sure you are going to get a great result from your body contouring procedure, whatever you choose to have. And I think everyone's different for this. I mean, someone was talking to me the other day about a circumferential with an FDL. And I think we've all just developed, I think that's one of the problems with plastic surgery, but also niche operations in plastic surgery and massive weight loss operations in the UK anyway, I would say would be still considered a niche area, and I think probably we're all developing our own views on it. I don't think there's any answer to it. So personally, I wouldn't do a 360 with an FDL. So I wouldn't do a 360, which is a circumferential tummy tuck with a vertical ellipse. I think there's just too much hanging about in the wind there, and blood supply of that T junction. And it's just not something I would do. I think an FDL is good for narrowing the waist as a standalone procedure in the tummy tuck arena, but I think a 360 will address that excess skin in the hip area better than an FDL. So I think an FDL will tighten the skin in the sides and will pull it together and make the waist better. But I think a 360 will address that more effectively by actually excising the skin over the hips. So so I wouldn't do an FDL and a 360. I would say if you've got excess skin around the hips, the 360 will address that. So personally, I wouldn't do that. Also, you're saying at the top of the tummy. So again, 360 will, to a degree, address skin at the top of the tummy. Really, this is something. It's a slightly difficult one, and one probably would need a consultation to be seen in real life, because it depends on how much skin you've got in the upper abdomen. Whenever you have a problem with excess skin in your abdomen, it is always worse in the lower abdomen than the upper abdomen. It is always worse below the belly button than above the belly button. So all the tummy tuck procedures are addressing the lower abdomen and to a greater or lesser degree are taking that tissue out of the lower abdomen. But sometimes people do worry about the upper abdomen. Is that going to be addressed? So it's only addressed indirectly. The pull is indirect with the tummy tuck, and it's not addressed directly. And for me, and again, it's sort of my view on this, an FDL doesn't particularly address the upper abdomen very well. So an FDL is not going to do the upper abdomen a great service. because the amount you take, it's more for the size, the FDL, it's more for narrowing the waist. So if you are going to do anything to the upper abdomen, the majority of people don't need it. Pretty much everybody, I think I can say everybody, I might be wrong here, but most people have more of a problem with the lower than the upper abdomen. So you would do a sort of standard abdominoplasty first. But if you did have kind of rolls of skin underneath your breast, if you've had a significant amount of weight loss, that might be the case. You might have a significant amount of skin in your upper abdomen, then that could be addressed with a reverse abdominoplasty as a second stage. So I wouldn't do an FDL as a second stage. I think that's unlikely to be needed. I mean, you could have it, but it's unlikely to be required. But I would think about doing a reverse abdominoplasty if you have significant excess in the upper abdomen, and that will take that excess off the upper abdomen. So that's something that you could think about. But as I say, usually you would address the lower abdomen first in terms of whether it be an FDL or a circumferential. And it would be either a circumferential or FDL in my hands. I wouldn't do a circumferential with an FDL. I don't know if anyone does that. Presumably they do, because this person's asking about it. So I'm guessing they've seen someone who's suggested that. I don't know. But I've never done it. On full disclosure, I've never done a 360 and an FDL. I've never seen the need for it. And I don't think I would do it. Never say never. But I think I would do one or the other personally. It's hard enough doing a 360, but doing a 360 with an FDL, crikey, that would be even harder. So, yeah, that's where I am on that. What? Do we offer fat pad removal? Fupa, what? Fupa liposuction? FUPA liposuction? Oh, I should have gone through these questions, honestly. I haven't gone through these questions. I don't know. What is FUPA liposuction? Do we offer fat pad? Right. Well, this sounds facial. Fat pad removal is usually facial, and we don't do facial plastic surgery. We do breast and body. So that would be a no. I'm assuming it's a facial fat pad. And is that Mons? I don't. Is that a joke, Corinne? I don't think. Is it Mons? I don't know. Maybe she's not joking. You mean who's asked for the who's? That's Mons lipo, I think. Is it? Okay. Oh, FUPA. Is it? Oh God. Listen, we're just lucky everyone hasn't arrived yet to see you telling me what is FUPA Mons Fupa. Do I need to Google it? Oh, anyway, is it? Okay. I'll take your word for it. Is that what fupa liposuction is? I think so too. What is? Anyway, never heard of it. Never heard of fupa liposuction. But do we do liposuction to the Mons? Yes, we do. Oh, Shahil's here. Have you ever heard of fupa liposuction? Anyway, I've got to be honest with you. That's not a medical term, all right? I'm sure the medical people fraternity would back me up on this. FUPA liposuction, never heard of it. Anyway, yes, I would do liposuction to the Mons. And fat pad, you wouldn't normally call the Mons a fat pad. Fat pad in my world would be more of a facial thing. But anyway, if it is a Mons, yes. So liposuction and to a degree, fat pad removal, you can take kind of like a slice of cake out of the Mons. But you can't do too much in terms of undermining in the Mons because it will lift the scar can lift up and give you a scar that's visible above your underpants. So you can't go too much undermining. I wish I'd looked at these questions before I came on live. This is a problem with live TV, isn't it? Anyway, there you go. That's awkward. So yes, we do fupa liposuction, fully certified fupa liposucker right here. Done all the fupa courses, and so if you want fupa, then I'm your guy. Just not sure what it stands for, but yeah, we do liposuction to the Mons area. Right, Fairy Dust, I'm glad you just arrived here. You've saved me from the awkwardness of my followers telling me what the question meant. Right, let's move on to another question, shall we? I think we've done the Mons one. What are the pros and cons of having combined surgery? Here we go. I'm on solid ground now. Back onto solid ground. Pros and cons of having combined surgery: breast lift with implants and a tummy tuck. Pros: all in one operation, one lot of sick leave, one lot of healing. If you do get a problem or whatever, then it's sort of like it's all healing together. So usually, when you do a breast surgery and a tummy surgery, usually the tummy is the kind of overriding one, and the breast sort of heals while in the background. So there's an economy of cost because you only have one operating the slot in theatre and you only have a one hospital stay, so it's cheaper to do it that way. You get it all done in one go. So those are the pros. The cons are it's quite a bit deal. It's a big operation. It knocks you back. You're kind of doubling your risk of complications because you've got risks of complications with your breast and in your tummy. So if you get a bit of wound healing problem here, bit of swelling there, it can be a bit distressing if you think, oh my God, it's all going wrong. It's all, so that can be quite a lot to psychologically and physically attend to. It's cons, other cons. Oh God, am I on pros or cons? I'm on cons, aren't I? So 2 operations, they need to be at least 3, probably 6 months apart. So you're looking a good year or 18 months to get over everything. So that's a con. I guess the cons are the same as the pros, but not that. So yeah, I guess you can just do the pros, can't you? And just say the cons are not that. So it's a very personal decision. There's no answers to it. People kind of often look for the answer, but there isn't an answer. It's just what suits you and what's right for you. And if one thing's an overriding thing, just have that thing. But if you want them both done and you want one time off work and etc., then a lot of people do have it done as a oneer. Do we offer Alarplasty? Now, don't you lot tell me what an Alarplasty is now, because I know what it. Now, stop it if you don't start going on about Monzas and stuff. Alarplasty, I'm assuming that means your alar of your nose. No, that would be someone who does rhinoplasty would be doing Alarplasties, and that is a rhinoplasty kind of guy, which I'm not really into the rhinoplasty. Rhinoplasty is a difficult, basically, and you need someone who specialises in it. I wouldn't have a dabbler. There's quite a lot of dabblers out there, and I think rhinoplasty is a dangerous dabbling one. For personally, I think you need someone who focuses on it. Can I bring my toddler to my consultation for breast implants? By the way, if you're watching this, Amy, if you have an answer that you want me to give, just put it in the private note. Can you? So a question like this, where you probably know the answer better than me, if you just put it in the private note, because people can't see the private note, then I can answer it effectively rather than me having to think of an answer where I might get this wrong. Can I bring my toddler to my consultation for breast implants? Well, people do, don't they? So I guess the answer is yes, because people do, because they have to, because they're often, childcare and what have you. So yes, you can. Yeah, you can. I mean, it's kind of, I mean, I guess you would probably be more focused if not, and there's something to be said for not, because you would have more attention and you worry about your toddler toddling around. But, we're not going to say no. So I guess that you would probably be more focused without your toddler. But if you have to bring your toddler, by all means, bring your toddler. And if you're not very focused, if you're a bit distracted, then you can always come back and go over it. We'll go over it again. So, it's better than, I guess a toddler consultation is better than no consultation, isn't it? So, yeah, go for it. Bring your toddler. Bring them along. We've actually thought, God, this is awkward when you think about this, because it's going back years. I'm going to say, well, since I started opening the clinic, we thought of having like stuff for toddlers, like little, oh God, little bricks and things like that. And now look at us, 10 years later, we haven't done it. Like a box, you know. It's because we don't get them very often. That's probably why. But yeah, in answer to your questions, yes, by all means, bring your toddler. When having breast augmentation, will it make a difference in size if it's over or under the muscle? Did I do a? Sure, I did. Did I feel like I've done something about this. I feel like I've answered this. Maybe it was just one-on-one. Anyway, so I'll do it for the greater good. So so this is for everyone here now. If you're having a breast augmentation, will it make a difference in size if it's over or under the muscle? People say, I mean, the reason you're asking the question means you've heard somewhere that it does. So you know that people say that it does. People say that if you're having it under the muscle, it kind of squashes the implant a bit, maybe. So like, should I have a bigger algorithm time? Absolutely. Should I have a bigger implant if it's under the muscle? For me, I think it's such an imprecise science, particularly in view of the volume of the implant. It is such an imprecise science. I wouldn't make that a factor in deciding on what size implant to have. If you're having them under the muscle, I wouldn't then upsize your implant. Now, when you get into it, when you get down to it, I tried to sort of kind of demystify the whole implant thing by having my trident approach, which is what we do when you're in the clinic. Then I've got my 10-step approach, which is the whole process for maybe I shouldn't call them both approaches. So my trident approach and my 10-step process. Yeah. So the trident approach basically says how you choose an implant and and it's how I choose an implant kind of with you. And what I do is I, number one, measure the width. Number one, the width of your chest, not, the width of your chest, the width of your body. So I measure your frame, number one. Number two, we look at your breast shape and we look at the shape and the profile of implant that you want. So implants come in round and teardrop, and they come in low, moderate, high, and extra high profile. So those are the shapes and the profiles available. And we have to add the shape and profile to your breast. So it's very hard to say this kind of shape gives, some people say teardrops fake. Teardrops natural, rounds fake. It's not as simple as that. It depends on the profile and it depends on the shape of your breast that you currently have. So we have to take that into account to get an idea of shape profile. Once you've got an idea of shape and profile, the width is set. The volume is then kind of decided for you. So the volume is the last part of the trident approach. It's the third step. And so it's not actually as important as I think some people think it is. So so questions like this, will it, should you go a bigger volume if you're having it under the muscle? Well, no, because that's not in my algorithm, because a bigger volume will either be wider or a higher profile. It'll be a different shape. So no, I guess is the answer to that. No, I don't. Well, will it make a difference? I don't know if it makes a difference. I think if it does, it's not going to be significant difference. Should you change your choice? No, you shouldn't. I think you should choose the same volume that you would have chosen anyway. And as I say, I go more on the width, the shape, and the profile, which then lends itself to a certain volume anyway. So I'm more about the measurements rather than the actual volume of the implant. Although when people come for implants, all they talk about is the volume, but it's actually not as important as I think people think it is. That one. Sign that one, clear that one off. Do we treat seborrheic keratosis? Yes, of course we do. Yeah, seborrheic keratosis is very common, usually kind of brown, often kind of scaly and stuck on appearance, sometimes kind of dry areas of skin that can be annoying, can be unsightly. And yeah, absolutely, we treat them. We cut them out, we shave them. We will for sure treat a seborrheic keratosis. Absolutely. See and treat clinic on the day service. You heard it here. Call now 0800 0121 454 3680 to book a consultation. Can we remove a cyst located on the external vaginal wall? Blimey. External vaginal wall. Crikey O'Reilly. I'm trying to picture it. Are we talking labia? I think that's kind of labia, isn't it? External vaginal wall. Probably not. Probably that would be gynecologist. I put it like this. I'm sure a gynecologist would put it like this, because there's cysts in that area, Bartholin cysts and cysts in those areas which are specific for the genitalia, and so I would say a gynecologist would probably be a safer option. We would sort of deal more with skin cysts. So if it's I'm going to say no. I'm going to say that's going to be a gynecologist rather than a plastic surgeon. I mean, yeah. I mean, we always have a look at things. If you want us to have a look at it, you can send us a photo and stuff like that if you want an opinion. But I think it's probably going to be a gynecologist, that one. My thought on that. Come on, has anyone got any live? Have I missed anything? Come on. Have I missed something? No. That's more like, oh yeah, Mons lipo. That was a Mons lipo humiliation early on. I certainly didn't miss that. Right, okay. Right, I'm going to go and Google, what was it? Fupa liposuction. And I will be back next week, same time, same place. Next Tuesday. Is it Easter yet? Don't think it's Easter, is it? Anyway, if it's not Easter, which I'm pretty sure it's not. Yeah, I'm pretty sure it's not. I'll be back next Tuesday. If you've got a question, call me. Put it in the chat. I don't know why I'm doing that. Is the chat below here or wherever the chat is? Message me. What's happened? Hold on. Oh my God. I missed questions. What's your favorite surgery to do? You personally, not results / persons related. Well, I don't know. I don't know. One of the reasons I kind of just do breast and body is because I like doing breast and body. I found things like facelifts and blepharoplasties and brow lifts, and they're quite. I didn't find them quite as rewarding. So, this last couple of days I've done some breast reductions, which were great. I love doing breast reductions. But then I've also done some breast augmentations, which are great also because, they're kind of a lot sort of more direct, I guess. So that really answers you. And I love doing tummy tucks. Tummy tucks is a great thing to do. It's very satisfying doing a tummy tuck. What's my favorite surgery? Right, if I'd say one, maybe I would say, see, half of me going breast implant, breast augmentation. No, tummy tuck. I'll go tummy tuck. Tummy tuck. It's my final answer. But but I like them all. But tummy tuck's my final answer. But I do like breast lifts, reductions, implants. So, what time frame would you recommend? Oh God, what time would you recommend for? Oh, sorry, Heather Amanda, I keep on almost blocking you for revision surgery. Oh my God, Corinne, what are you asking that sort of question? For your scars, yeah, okay. In general terms, you wouldn't even think about revision surgery for 3 months. Ideally, you're kind of looking at 6 months, really. Well, I say ideally, 6 to 12 months. It kind of depends on what the revision is. If it's something that might get better, things like dog ears and things like that, the longer you leave it, the better, because they might get better. If it's something that barn door way off and you think, oh God, that's not going to get better, then you kind of want to do it sooner in order to get a happy patient quicker. But at the same time, You don't want to do it too soon because it's quite hard to do revision surgery in the first few months because everything's quite hard. The scar tissue is quite hard, quite unforgiving, and it's not very nice to operate on it. So it's not very nice operating in the first few months. So you kind of wouldn't even entertain the thought in the first 3 months simply because it's scar tissue is very hard, and also it's quite swollen. The tissue's unforgiving, and also the result's not fully settled yet. So 3 to 6 months if it was bad, depending on how. If it wasn't bad, 6 to 12 months. I think 12 months is kind of normal when things are sort of not 100% settled, but pretty much settled. If there's something still there at 12 months, you'd be like, yeah, okay. Maybe 6 months, you'd say the same sort of thing. If there's something there at 6 months, you think, okay, yeah, it's, whatever, too big, too small, too dented, too this, too that. So 6 months is kind of your happy medium type place. But you try and do it with the patient, work with the patient, because the longer you leave, it's a lot easier if you leave it longer because its tissues soften, and it's amazing how much settles as well. I think people often don't realize how much it's going to settle. I've got photos where it's kind of still, scars are still quite red, quite active at 8 months, 16 months they're completely faded. So if you say to someone at 8 months it's still going to settle, they'll be like, oh yeah, really? So yeah, just try and work with the patient with that one, Corinne. But 6 months. Half term next week. Is it half term next week? And week after? What, 2 weeks up? Oh, heck. I don't think it's half term for me, is it? Actually, I think it is now you mention it. They're breaking up on Friday, aren't they? But I don't think I'm off. Is the recovery for breast implant replacements the same as when you had them in originally? Well, it depends on basically whether you're having a capsulectomy. I think that's the big. So I'm guessing from the sense of your question, it was a long time ago you had them in. I might be wrong, but if it's a long time you had them in, they might have gone hard, and you might need that, and that's called a capsule, and you might need that capsule removed. So that is a slightly bigger operation than putting them in the first place. You often need a drain for that operation, which keeps you in overnight. And it's quite kind of traumatic, that operation. If you're just having them replaced and no capsulectomy, then it's less. The recovery is less. It's easier because the pocket's already been made. So it's either easier or more difficult, basically. If you're not having a capsulectomy, it's easier. If you're having a capsulectomy, it might be a little bit more difficult. So it revolves around whether that scar tissue that's formed around the implant needs to be removed. That's great. Thank you. I'm seeing you next month. Anyway, great, Corinne. See you. I'll see you anytime. Looking forward to seeing you next month. Have I missed anything? I don't think I missed anything. So, over and out, Roger Wilco. Yeah, I'm pretty sure I'm here, even if it is half term. I'm pretty sure I'm next week. So I will see you all next week. So get your questions in, because that's how you get them answered. Chloe, what are you doing this time of night, love? It's 7:32. This is 7, love. Anyway, I haven't missed anything. Fupa, liposuction and stuff like that. So thanks, Jackie. I will. I'm checking out, and I've just made some dinner, which has probably gone bad because I had to come and do this halfway through trying to make it. So enough of my problems. I'm going to get back to it. Informative live. I've always Antiques Road Trip. Corinne, I've got to sort the dinner out because I'm halfway through it because it was a parents' evening and my wife's out, and so Antiques Road Trip is a dream at the moment. 7:30. I might get the 8 o'clock one, but yeah, thanks, Corinne. And look, Facebook. I'll check out Facebook. Thank you.